PCN is a primary care network, and it is the coming together of practices to work at scale and collaborate on various operational matters.
To deliver a contract to their patients in that area around health and inequalities and making their lives better in their communities.
All practices are private businesses. Some of them are owned by slightly larger organisations, but essentially if you think of them all as individual businesses, you're asking 2, 3, 7, 10 businesses to work together across a PCN and to work together towards a common goal, pulling together the different teams, so all the respiratory teams achieving a common target, or the cardiovascular, the cancer teams, and all of those sort of clinical teams, but there'll also be operational targets as well.
Meetings range from just like meeting with peers, like my other ops managers. So there's a lot of collaboration that we do as a primary care network, trying to make the links not just for healthcare, but all the other charitable organisations, so that we can work with our patients in a more effective way.
The ops leads go out to the practices, have the individual conversations, find out what's really going on in practice, and feeding back up into the wider system.
It's a sense of achievement and that you're working together collaboratively.
I love the fact that there are no 2 days the same.
I love all of my job. I love the people I work with. I love the practices that I work for. Absolutely brilliant bunch of people, and they work so hard.
It's about generating the care for those patients at the end of the journey. So I only do what I do to make sure that that happens. But obviously that patient care can only happen if we get income to the practices. So we have to hit these targets to get the income to come into the practice, to then have the money to be able to fund the workforce to deliver to those patients.
Doing something good for the patients is the best thing. Going out and saying, we've got this team for you, use them, and that they'll be able to help you. There's good careers within the NHS, and you don't have to go to sixth form, you don't have to go to college to get into a managerial position. I didn't. I just had my GCSEs, but it's a good career to be in. And if you've got a caring nature, you want to help people, it's the right job to be in.